Hello everyone, I'm Megan Franzen. I am with Patients Medical. We're a holistic medical center in Midtown East Manhattan. I am here with Dr. Gino Bottino and Dr. Stuart Weg, and they are two of our medical doctors here at Patients Medical. Dr. Bottino is our holistic oncologist, as well as a hematologist and an immunologist. And Dr. Weg is our alternative pain management specialist, and he also deals with chronic conditions. And we're talking today about hepatitis C. So Saturday is World Hepatitis Day, and in honor of that, we are releasing a blog, but also we wanted to get our experts' opinions and more information about hepatitis C. So, Dr. Bottino, we'll start with you. Tell us a little bit about the hepatitis C. So what distinguishes it from the other hepatitis viruses?
Well, hepatitis has been around forever. Since the Egyptian times it was known.
Wow.
Hepatitis is a viral illness which is ubiquitous. Originally, we started out simply with the original virus called hepatitis A, and then we discovered that there were other forms of hepatitis, and we just called them non-A. And hepatitis A is a very common virus, and thankfully it is a mild virus which is self-limited. Patients get sick. They usually suffer for 6 or 8 weeks, and then they get better, and there's virtually no mortality. Then we discovered hepatitis B, which is a more significant virus because it leads to morbidity and mortality. It is a significant cause of cirrhosis, liver failure, hepatitis cancer, hepatitis leading to cancer. And however, it is also usually self-limited. And the good thing about hepatitis B is that we have vaccines for hepatitis B now.
Okay.
And hepatitis B vaccine is commonly given to children, babies, and also to workers in institutions and anyone who is exposed to institutional life because of the proximity and the closeness of living.
Okay.
And so hepatitis B is becoming less of a problem in the world, especially in the U.S. because of availability of vaccinations.
Great.
And so hepatitis B has, in some sense, been conquered. That's a good thing.
Great.
And then we used to call other hepatitises non-A, non-B. That's just it was just really
it's the evolution.
The evolution of it, right? So then now we have hepatitis C and D. All right. Hepatitis C is unfortunately a disease that has no vaccine and has poor cure rates, and is not self-limited, meaning that if you get hepatitis C, it will be active in your body forever. It will continue to be a problem. It can get worse and worse. It can develop cirrhosis, liver failure, and liver cancer, which is the prime morbidity in many ways. Currently, hepatitis D is pretty uncommon still. Unfortunately, hepatitis C has become very common in society for a variety of reasons. One of them is that it's a sexually transmitted disease, as is hepatitis B. And like most sexually transmitted diseases, over time, they become very common. We all talk about herpes, right? So when I was a kid, we all talked about, oh God, you can't kiss anybody, nothing, you get herpes, right? And so we were all worried about that, and this was, a while ago. And
we won't ask how long.
Thank you. And herpes was only 5% of the population. Now, herpetic virus is ubiquitous in the population, and 95% of everybody in the United States has herpes zoster. So that is the nature of these kinds of viral diseases. As time goes by, the infected population becomes higher and higher and higher and higher, especially because of the mode of transmission is sex, and humans like to have sex. It's just true. Right.
And we won't say anything more about that.
Okay.
But I will ask, are there other ways that hepatitis C can be transmitted in addition to sex?
Of course. The most common way is bloodborne. So unfortunately, hepatitis C is one of the most dangerous results of transfusions, and is in many ways the bane of transfusion medicine. We do have tests for hepatitis C. Unfortunately, there's a window where the tests are not positive. And what I mean by a window is that if you get hepatitis C, it won't show positive in your blood for many weeks. And so this window allows you to donate blood, the blood to be tested and then transfused to other people without the system knowledge that that person has hepatitis. So that there is a window in which you can, donate blood and nobody knows you have it, and the testing is negative, and then unfortunately you get it from a transfusion. And other, obviously cuts, bruises, transmission along those lines can happen. Unfortunately, in some segments of society, like people who share needles for drug use and stuff like that, it becomes more and more common. It's also common, in the gay community.
Okay.
Mostly, I guess it's because of sexual transmission, mostly in that. But so it's unfortunately it's becoming more and more common.
Okay.
And since there isn't a vaccine and treatment is problematic, it's becoming more prevalent.
I understand. Okay. So it sounds like there's no cure. Cure as we know it.
No.
You can treat it, but
Well,
it can cure.
some people are cured.
Okay.
Yes, we do cure people today.
Okay, great. Well, that's the reason why we're here today, is to learn more about this. So let's talk a little bit more about how do you treat hepatitis C, Dr. Weg?
Well, let me give you an introduction. I began to notice that my chronic fatigue patients were often hepatitis C positive years ago. And I began to recognize that hepatitis C was associated with chronic fatigue in many patients. We were using anti-infective protocols to treat those patients, and it made good sense that we could treat a viral infection using those protocols. The modality that worked the best was a technique we used called ultraviolet blood irradiation, whereupon we take some blood out of a patient, expose it to a special ultraviolet light, and return it to the patient. And this really panned out quite well. Some companies were formed, which I worked with, to develop this into a commercial product. The process is still ongoing. What we found was that we could not document a cure, and we would never say that we could cure the disease. Although perhaps someday in the future I may not change that. But for now, we were able to follow the viral load on laboratory results, follow the liver functions on laboratory results, and occasionally follow the results on biopsies of the liver, such that we could comfortably say that ultraviolet blood irradiation would control the disease. And many patients came to us, although we never said that somebody should avoid mainstream therapy. Somebody who was offered interferon therapy or other mainstream therapy is not advised to turn it down in favor of an alternative therapy. However, people came to us because they did not want the side effects of the mainstream therapy, and there were no side effects from what we were doing. And it could be, we could manage patients and watch them month to month and treat them accordingly with a treatment or two a month, once things got stabilized. And we could keep them indefinitely at a level.
Interesting. So the ultraviolet blood irradiation really giving some patients hope.
Oh, yes.
Mhm.
Oh, yes. We had patients, and, you know, and then sometimes, I don't want to say a cure, but, you know, we'd have a patient disappear, and I think, oh, well, and then they'd call back years and years later and say, you know, I was okay for all these years, but I want more treatment now.
Mhm.
So we did see, I don't know what you call a cure, but we did see remissions that were at least 5 years.
Great.
You know,
Excellent.
and since the procedure is really almost free of side effects, you know, it's something to offer patients who can't tolerate interferon or won't tolerate interferon.
Interesting. Thank you.
You're welcome.
So Dr. Bottino, do you want to comment on interferon and whether
Sure.
you would ever recommend that to a patient?
Well, I was a researcher at the National Institutes of Health, and I was one of the first doctors in the country that used interferon.
Oh, wow.
I was at what was called the BRMP, or the Biologic Response Modifiers Program of the NCI. And at that time, we were first starting to use interferon in the country. And interferon is a natural occurring product of the body. It's called a cytokine. That means it is a product of certain cells in the immune system that it's called interferon because it interferes with the production of viruses.
Quite logically.
and it is the body's natural defense against all viruses. Okay, so we produce interferon, we make interferon to fight viruses. That's what interferon is.
Okay.
Now, there are several forms of interferon, but I won't get into that. So what we were able to do, and what has now been done, is that interferon now is manufactured using genetic manufacturing techniques with E. coli. And it is produced in large quantities. The body only produces so much interferon. Okay. So what has happened is that using interferon and other adjunct therapies, there is about a 50% complete response rate, with many of those patients going on to be disease-free.
Wow.
And so, you know, from a traditional medical point of view, you know, the scientific evidence is that interferon will cure people with hepatitis C. Now, as Dr. Weg is pointing out, interferon is pretty toxic stuff. Unfortunately, many patients are unable to even take it. To have interferon successful therapy, you have to have it for at least a year. It is very difficult to get through a year of interferon therapy.
So it makes the patient so sick.
It makes the patients very sick. And so if you kind of look in general at the population of people who have Hep C, you know, first you're limited to the fact that maybe only half of the people can even tolerate it, and then only half of them will be successful, and then a portion of them will fail too. So you still have the majority of people who are unable to take interferon or to tolerate it very well.
Okay.
So that leaves.
What would you recommend then?
Well, so that leaves a large group of people who still need to be treated. And so for those people, you know, now you're leaving the area of what, you know, traditional medicine will provide. And it's not, you know, I've made this point before, you've heard me before. The traditional doctors are only paid for thinking with inside the box and for what they do in the box, right? If you try to do anything else than what the insurance companies and government want you to do, you get slapped on the wrist and not paid. So they don't do anything else. Do you understand?
Yes.
Okay, so.
I'm sure everybody here can probably understand that as well.
Right. I mean, what happens is that, you know, every doctor wants to do a holistic approach to their patient. Every physician understands that implicitly. You got to take care of the whole person. You can't just treat a disease. But we end up traditionally only treating diseases, not patients, because of these limitations that society has placed on us, and monetary limitations. So it limits these people in their availability to get treatment, and to look for anything else other than what is offered to them.
Right.
So the first thing that's obvious is that immune therapy, which is in general what interferon therapy is, right? Changing a person's immune system can help people enormously, can fight these infections. So
sounds logical.
right. So how do you fight an infection? How does anybody fight an infection? What are the common things? What are the common sense things that every single person knows? I mean, it's not rocket science. If you're well rested, your immune system works better. If you have good nutrition, your immune system works better. If you have good activity levels and are exercising to a moderate degree, your immune system works better. If you have proper, not just eating well, but have certain proper nutritional supplements, your immune system works better. So that's how we try to, treat a patient. And not only that, psychologically, it's important. Doctors tend to forget, again, from the non-holistic point of view versus the holistic point of view, that your psychology and your ability for your mind to help you is enormous, but ignored, right? So that too, people need to be calm. They need to spend time meditating and learning how to fight disease with their mind.
Instead of obsessing about, am I going to die from this? Am I
exactly
death sentence?
right? There is a whole integrative approach basically to the patient that you want to take. That starts with their mental status, their mind, teaching them things like relaxation therapy, kinetic therapy. You want them to have proper exercise. You want them to have proper nutrition. Like everything else in the body, you don't want too much or too little of anything, right? People don't understand that sometimes. They think, well, if a little bit helps, then a lot is great. Not true. And that's also true of nutritional supplements. And what we do, which is important to understand, is that if you take too much of something, even if that something's good, it's bad for you. You don't have enough of something, you need enough. You need the right amount. And so we work on that with people to try to provide the right nutrition, the right supplements, the right overall milieu for them to get better.
Absolutely. Well, thank you very much, Dr. Bottino. Thank you very much, Dr. Weg, both for your expertise. And so just to kind of send you away with a point here, just letting you know that you can partner with a doctor who actually has these protocols in place, that is an expert in helping you treat hepatitis C or whatever other chronic conditions you have. It's important to partner with somebody who's a trained holistic professional who can counsel you on all of these different options and find out what would be the best treatment for you or for your loved one that's experiencing hepatitis C. So I'm Megan Franzen. Again, this is Dr. Gino Bottino and Dr. Stuart Weg of Patients Medical here in New York City, and we will see you next time. Thanks.